We will talk about bariatric surgery. What means bariatric surgery? It is different types of operations which are made for weight loss. What is the primary motivation why people are doing bariatric surgery? Because it causes significant weight loss, and this weight loss is sustained in time. So why it's very big issue? Because when people losing weight, we are only diet, they will gain weight again within 5 years, 95% probability. So 95% of people who lose weight via diet regain this weight within 5 years. That's why people requires and people want sustained weight loss. And in case of bariatric surgery, this probability that your lose weight will be sustained, there is 60 or 70% probability. So it has much better effect than compared to only diet. Also, bariatric surgery improves conditions like diabetes, hypertension, and sleep apnea. So when people have such problems, they commonly use bariatric surgery because there are comorbidities with obesity, especially if people are too obese or they have BMI more than 40, for example. First and most popular bariatric surgery is sleeve gastrectomy. 70% of bariatric surgery is sleeve gastrectomy. It's most popular. It's not gold standard of treatment of obesity, but it's most popular. Why? Because of high safety and high effectiveness. With sleeve gastrectomy, people lose 30% of their body weight. Around 30%. It means that if person weighs around 220 pounds, he or she will lose around 70 pounds. And these results will be maintained or sustained for 5 years with 60% probability. It's considered very good result. That's why people are doing sleeve gastrectomy. What is the idea of sleeve gastrectomy? It means it is laparoscopic surgery. It means that surgeon doing several holes, several cuts on the body, usually 5 or 6 or 4, and they insert small camera, they insert tools, and they cut gastric, they cut stomach, they cut gastric, they remove almost 80% of part of gastric, this part they remove, and they only left tube-like or sleeve-like tube, and at this case gastric size dramatically decreases. When gastric size is decreased, person has fullness very easy, some person eats less. Also, this part of gastric which is removed from our body is rich in hormone producing cells, and these hormones causes hunger. These hormones are ghrelin, and when we remove 80% of our gastric, it means that also it reduces hormone production, and it means less hungers, and for people much easier to eat less. This procedure, sleeve gastrectomy, is considered safe for most people, but it still has some safety issues. Most common side effects are nausea, vomiting, acid reflux. Acid reflux is important side effects because it can be worsened if person already has acid reflux, or it can be newly occur. So acid reflux is problem, but usually it's temporary. Usually it improves in time. Sometimes bleeding can occur, sometimes leaks, and if it leaks, gastric material can leak into abdominal cavity, and it can cause serious inflammation, and another surgery may be needed as this case. So it's important complication, but it's not common. Also, blood clot formation also possible, and people with bariatric surgery usually require lifelong vitamin intake. It's important because they have problems with absorption of vitamins and minerals. Another very important and new method of bariatric surgery is Apollo OverStitch or endoscopic sleeve gastroplasty. What it means and why it's important. Actually, it's almost same procedure as sleeve gastrectomy, but it's less invasive. Less invasive means that surgeon does not do these holes on the body, and it's less traumatic. It is doing via endoscope. Endoscope is a small tube which is person swallows it and through your throat, and surgeon doing it via endoscope is much less stressful and less traumatic method. So Apollo OverStitch is actually new method, but it has big future because it's much less invasive. It is safer than almost any other bariatric procedures, and also has high effectiveness. Now, what about its effectiveness? Effectiveness is around 20% weight loss, and it is considered favorable also for people who is not very obese or people whose BMI is around 30. So it can be done much wider population. It's less invasive, it's safer. That's why it's very important, and it can become very popular over time, like sleeve gastrectomy. What is the idea of this endoscopic sleeve gastroplasty or Apollo OverStitch? Idea is that there is stitches or sutures in the gastric which is made by the surgeon, and gastric will decrease in size because it creates some folds, this like folds, and it decreases in size. So almost same procedure, but different from sleeve gastrectomy is that in sleeve gastrectomy we remove 80% part of gastric or stomach, but at this case everything stays here, just you doing these sutures and you create these folds, and gastric decreases in size. So that's an important difference. Now let's say about safety. Apollo OverStitch is considered very safe procedure generally. Perforation is most important risk and most important complication, but it's rare. It's around 1 or 2% of cases, but it's rare, really rare. Bleeding is another very rare complication which occurs sometimes, and there is no other important complications. Of course, maybe vitamin and mineral intake required after surgery, but usually it's safe. But weight loss is not as stronger as in case of sleeve gastrectomy. It's around 20%. So, but it's still effective, still very effective, and also this result can be long lasting also. But we have no enough studies, we have no enough data to say that if this endoscopic sleeve gastroplasty is superior compared to sleeve gastrectomy, because it's a newer method and not enough data. But theoretically and with high probability it should be much more favorable surgery. Third most important bariatric surgery is gastric bypass, or Roux-en-Y Gastric Bypass. It has very high effectiveness, 30% of body weight, and sometimes 40% of body weight can be lost. So it's very effective, and it's second most common bariatric surgery is doing, and it's very popular in people, and it's most commonly done in people who has very high BMI. So if person has BMI more than 40, for example, a gastric bypass is better surgery compared to other types of bariatric surgeries. Or if person has severe acid reflux, in this case gastric bypass is important also. And what is the mechanism of gastric bypass? Mechanism is that surgeon creates such pouch here. It creates a small pouch from gastric, and it directs it into intestines directly. So it bypasses whole gastric. This part of gastric is empty, but still stays in the abdomen. It still stays, nothing is removed, but it creates this bypass route for food. And this pouch is usually X size. So this pouch is small one. And it creates impression that it looks like Y. You can see this one, and this one. It looks like Y, that's why it is called Roux-en-Y Gastric Bypass. It's very effective, but it's difficult and complex surgery, and it has more complications. It requires lifelong vitamins, lifelong minerals. It's important. Also, sometimes internal herniation happens. That's why it's also more traumatic. It's more traumatic surgery, but it is recommended in people who has high BMI, high body mass index. Also, there is adjustable gastric band bariatric surgery, but it's less popular, and because it has long-term side effects, and it's not popular actually. And there's also intragastric balloons. It means that balloons is inserted into gastric, then it's filled with fluid, and person has sense of fullness, and after 6 months it is removed. But this is temporary solution of problem, and it's not very effective. That's why intragastric balloon also not very popular, because regain weight after the 6 months is very common, and that's why it's not long-term solution of problem. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.